Keeping an eye on your health today. How do you know when is the right time to go to an urgent care clinic rather than the emergency room? Our medical expert Dr. Bose says there's a lot of misconceptions when it comes to those clinics. He sat down with Tatum Gwen about the issue.
The question you should ask yourself is, can this wait? Can this wait till tomorrow? So let's talk about urgent cares first. Urgent cares have often extended hours. There may be weekend hours. There may be extended weekday hours. And there's no level of certification. There's different levels of urgent care. So depending on the certification, there's no universal definition. There may be an X-ray. There may be EKG. But there are certain things that can go to urgent care. Broken bones can go to urgent care. You don't need to go to an ER. Fevers can go to urgent care. So if your child has a fever, often people get worried about how high the fever is, at 104, 105. And we don't get worried about the height. We get worried about how the child looks. So a fever, no matter how high, can usually go to an urgent care.
Okay.
And then there are certain things which are a little more severe. You should not wait till tomorrow. And again, it's usually the common sense test. You've been in a bad car accident, your chest hurts, so you're worried about a heart attack, your belly hurts badly, persistent vomiting over and over and over again, poisonings, you can't breathe, things that you're not going to quite make it to urgent care. That should be an ER. So in this community around here, you're going to see a lot of things with emergency in the name.
Yes.
It might be Excel Emergency Center. It might be Neighbors Emergency Center.
And these are freestanding ERs.
So essentially, think of this like an emergency room of a hospital.
Okay.
Except you've pretty much taken a saw, cut the ER from the hospital and put it freestanding. So they may be affiliated with the hospital, they may be independently owned, but the concept is the same. Once there's emergency in the room, or emergency in the name, what happens is it has to follow certain state regulations. You'll get a medical screening exam, and then once you're screened, you won't be first come, first serve. It's sickest come, first serve. So if what you often find when you go to a hospital emergency room is you go with something minor, you're waiting hours and hours and hours because there's heart attacks and strokes in there. So when you end up going to these freestandings, there's the equipment and the staff to take care of everybody.
That's important to know the difference between the two.
24/7 hours in the emergency, there's ultrasound, CT, we can take care of strokes, heart attacks, so think of those two differently. And finally, there's your retail health clinics, like in local retail stores, and there's your primary doctor, who you should go to in the first place to avoid going to the urgent care ER. So.
Absolutely.
And then other quick tips, remember, keep a list of your meds, your allergies, and in your iPhone or your smartphone, keep a list of your emergency contacts, often under ice, in case of emergency. So.
All right, perfect, Dr. Bose. Thank you so much.